Hi, I'm Aaron,
I'm Taylor.
and we're here to tell you about dry needling. I have a lot of questions that patients ask us what dry needling is. It's been introduced new to Florida, and there's a lot of curiosity of what it can do. And what we started doing with dry needling is provide our patients with more immediate relief from pain and muscle spasms that they may had for years, and they've tried other things to help. So what we found that what this does is really get to the root of the problem faster and gets them more relief and lasting relief better as well. What it is, we actually use acupuncture needles. So they're real small multi-filament needles that go in the skin, just like with acupuncture, but we go down deeper. We get down into the muscle, especially in the trigger points. That's the hardest part to get rid of with muscles. A lot of people have tried massage and aggressive massage, electrical stimulation, other modalities to try to get rid of these things, but what happens is they just keep coming back and are persistent. What we like to do is get down into the muscle and work from the inside out to get rid of those muscle spasms. What it does is really get down to deep into where the problem is, so that's why we get faster and longer lasting relief. So I wanted to show you what it looks like. So here's where, if Taylor had tennis elbow, because that's a very common place, that's chronic pain that lasts a long time and doesn't seem to respond to any other treatments, we are very successful with it. Actually, I just did my own tennis pro, and because obviously they got tennis elbow, and he was able to get back to teaching, and because he has to hold the racket all the time. All right, so Taylor, you ready?
I'm ready.
So this is where muscles are. What we do is we find exactly where a nice big trigger point is. Trigger points where we put pressure on and it could radiate pain other places. We start with the needle here, and it's in. And we find the spot where we want it, and that's right in the needle. That's it there. And that's dry needling. What we do with the treatment there, we could work the muscle a little deeper. We can move it around. We could treat it that way. We could take it and do a couple other things with it as well. So for really stubborn muscle spasms, we could add electric stimulation. You want to tell them about that too?
Yeah, we can talk about that. Just to kind of give you a feel for what you're going to feel, it's a little pinch when it goes in. It's not too bad, and then it should be like a little achy, a little soreness. But if you go back and you think, these muscles are already achy and sore, and they've been this way for a long time. They've been holding on to that tension, that tightness for a while, so we're just trying to basically release those. And I think one of the best things that it does is, when you originally heard it, like even stuff that's been going on for years, you can have problems with, but when you originally heard it, you have a healing response that starts. And then what we find is the body does kind of a half healing response, like it starts it and then it doesn't finish it. So what the needles do is they allow you to get deep down, like Aaron said, into those deep neural muscle fibers in there, and then they allow you to basically kickstart the healing process again so that your body can heal itself, i.e. finally getting rid of that long-standing tension that you've been stuck with.
Get some blood flow going.
Get some blood flow, exactly. Yeah. Blood flow does help heal. You talked about electrical stimulation. Sometimes we put an electrical pulse on it that the research shows just helps give a better stimulation, and then again kickstart that healing process all over again. It's mildly uncomfortable, but
at its worst.
At its worst, mildly uncomfortable, but extremely effective. Okay. And as you can see, I'm doing fine.
And he's not bleeding or anything like that. So
yeah.
That's what some of the concerns are. You could be sore afterwards. You could have if we hit a capillary, very small bleeding and bruising. Those things could happen, but it's rare. So we hope this helps you understand what it is. And if you have further questions, please contact us. You could contact us through our website or give us a call. We look forward to hearing from you.
Bye.